Good afternoon. My name is Sharon Romalchuk, and I'm the Program Manager for the National Genetics Education and Consumer Network, or NGECN, here at Genetic Alliance. This webinar on resources for advocacy through the transition years and beyond is an activity of the NGECN, which is part of the National Coordinating Center for the Regional Genetic Service Collaboratives and is funded by HRSA, or the Health Resources and Services Administration. I'm excited to introduce this webinar in conjunction with last week's official launch of the all-new collaborative tool, the Advocacy Atlas. We've been working over the past 9 months with Parent-to-Parent USA and Family Voices to create a resource that will empower individuals and families to advocate. We know that every day families have to advocate for the things they may need or want, especially if there are additional steps, challenges, or barriers because of special health care needs. We've been working so closely with Parent-to-Parent USA and Family Voices with the goals of engaging and empowering individuals and families, improving access to information, services, and resources, new partnerships, and public education. Our close relationship has been extremely valuable because we share many of the same objectives, and by combining our forces, we are able to reach and empower an even larger number of individuals and families. Just as a few housekeeping items, your lines are muted today, so if you have a question, please type it in using the chat box feature in the webinar panel. We'll take a few moments at the end to answer any questions we've received. Also, we are recording this webinar today, and it will be archived following the webinar. So I'll begin by showing the Advocacy Atlas and point out some of the key features, including how to access resources, and then pass it over to our guest speakers, who will talk about some of the topic areas featured on the Atlas and the particular importance the topic areas have to them. You can find the Advocacy Atlas at www.geneticalliance.org/advocacy-atlas. Here you see the homepage depicting a winding road. I like to think of it as the journey of advocacy. We've separated the resources into 10 different topic areas to make it easier to find resources. In each of the topic areas, we feature a personal story from a self or family advocate, as well as some pictures that were submitted by families. This is really my favorite part of the site because I think it makes it more real, reinforcing the fact that advocacy is a real part of people's lives and that each person has a unique story to tell. So I'll click here on Accessible Communities and show you what a page looks like. Here you can see each of the resources listed by title, followed by the authoring organizations. We know that there are so many great resources out there being developed by dedicated organizations. Our goal was really to create a place to feature those resources where they're accessible in one spot for families to be able to easily find what they're looking for. All of the resources are direct links, so you're not brought to another website and then continue searching for the resource you're looking for. The link goes directly to that resource. Also, at the bottom of every page, you can see a link to return to the Advocacy Atlas homepage. So going back to the homepage, there are a few additional things I'd like to point out. Below the map is a button where individuals can send feedback, especially if you have additional resources to add. We want to ensure that this tool continues to be useful and comprehensive with quality tools for families. So this is the survey that you would complete, giving us some information about who you are and how you're using it and how we can improve it. And going back, you can see the homepage again, as well as we want to mention our funders, as well as our wonderful partners on this project. So the next portion of the presentation, we will have guest speakers to first share their story about advocating and the skills that they have developed from their experience, and then highlight many of the resources found in the Advocacy Atlas. We'll be discussing 4 of the 10 topic areas, including education, services, and supports, transition to adulthood, steps to employment success, and youth leadership. For our first speaker today, we have Jennifer King, who has many roles, among which she is inclusion consultant for the ARC of Pennsylvania. And she'll be talking about education, supports, and services, and her son's experience. So without further ado, I'd like to introduce Jennifer.
Thank you, Sharon. As you mentioned, I'm a mother of a child with significant disability. I also have a sibling with a significant disability, And as a result of my experience with them, I have ended up working in the disability field as an inclusion consultant. My son is now fully included in middle school, and I'll insert information about his experience as I go along. So why advocate? Why is it important in education to advocate? And I pointed out some of the realities here of special education services. It's no surprise that students with disabilities may be more challenging and more costly to educate. And school staff may either unknowingly or even knowingly reduce the expectations for students with disabilities. Most people become teachers for good reasons, but there are many competing demands, including the realities of the finances, resources, and so on. And what I have noticed is that in recent years there's a very steep learning curve. For example, in the areas of autism and Down syndrome and so on, we are learning a lot of research, and so the expectations, the possibilities are a lot more now than they were even a few years ago. All students can learn, and it's important to continue to have high expectations for them. So each student with a disability who has an IEP is entitled to a free, appropriate public education in the least restrictive environment. That's a legal entitlement that you have. And unfortunately, after the student graduates from public school, there are few entitlements in adulthood. One is institutional care, and I don't know of anyone who aspires to have their child enter a nursing home once they get out of school. So not a good option, so it's important for us to take full advantage of public schooling while we can. Next slide, please. So the importance of the parent's role. You are the expert on your child. You know the child in many different settings and many different areas, and you're the only one who has that full range of experience. You're also the only IEP team member with a lifelong interest in your child. And I will add that you're the one that's going to deal with the consequences of a poor education once the child is out of school. So I commend you all for taking the first step in being part of the learning process in participating in this webinar. Next slide. So what are some of the areas that I would encourage you to learn? First of all, the basics of your child's disability. And for each of these, I included some resources from the Atlas. I had hoped to make these a direct link, and I'm not sure that that's going to work that way, but this is a copy from the Educational Resources page from the Atlas. Genetics Education Materials for School Success is one potential resource that you could consider. In my case, my son has Down syndrome, and there is information on Down syndrome on that page. He also has other challenges, medical challenges, sensory challenges, and so on. And when he was very young, I took a lot of time to research, find out more about him. And just to give you an example of one of the surprising things I learned was that people with Down syndrome often have an unusual aptitude for reading at a very young age. I learned that when he was very young, and he was able to actually start reading at age 3, which people did not believe. They were surprised, astounded. As he entered kindergarten, rather, he was tested to be reading at a 2nd grade level. So really smoothed our path, has really served him well. But nobody would have offered that information to us. We had to find that on our own. Another one is the IEP process itself. The process is very well designed, but I found that a lot of school staff don't really understand how it works and how to use it. So I encourage parents to learn the process, use the process, and ensure that their IEP team does also. I've included another link on there related to the IEP process. Next slide. Collaboration and negotiation skills. I was very pleased to see a couple of links on there for those. Unfortunately, as part of our process, we were involved in a year-long litigation with due process to get the education that we felt our son needed in a regular education classroom. I've continued to really emphasize learning and using collaborative practices because the IEP process is a team process. I can be the best advocate in the world, but I depend on the other team members to fulfill the various roles needed. Finally, I have on there familiarity with special education laws. Your child has many rights as a result of having an IEP. I encourage you to be aware of those, to use those. We did actually end up, as I said, going to due process, and that certainly is a very last resort, but it can be important when needed for your child, depending on your particular circumstances. Next slide. So educational placement. Federal special education law requires the least restrictive environment for our child. That is not the word inclusion. The word inclusion does not show up in special education law. And I did include the full text there from the federal special education law. I'm not going to read through that, but I will emphasize near the end there, it refers to supplementary aids and services. And that's really a key part. That's really the crux of the whole thing. My son currently is in a regular education, 7th grade. He participates in all classes successfully, but supplementary aids and services are really the key part for that. The next slide, please. Regarding supplementary aids and services, there is no limit for what the IEP team may be obligated to consider. I've listed some of the common categories on there, and I forwarded on to Sharon another resource that hopefully she'll be able to add to the ATLAS website. But in my own son's case, there were a number of resources or a number of strategies that we're using now that are very important for him to be successful. One of those is modified curriculum. Any child with an intellectual disability is not likely to be successful with a curriculum as is. In our case, we've identified that he's responsible for the key elements of the curriculum for each class, for each unit, and so on. He uses a laptop with specialized software, word prediction software, organizational software for his writing. He's hard of hearing. The each teacher wears a microphone, and his or her voice goes directly to my son's hearing aids for him to be able to hear adequately in all environments. We had extensive consultation with a specialist. He has little direct service, for example, therapists and so on. He only has a small amount, but he has extensive consultative services, and these consultants all need to communicate with each other to understand his needs and to modify supports as they go along. Another important one is we have monthly team meetings to talk about not changing the IEP, but just talking about implementation of the IEP, what challenges we're facing, and so on. So a lot of work, but it really has paid off, and it really is successful when people work together to achieve those. The next slide there, please. Potential advantages of inclusive classrooms. The access to the regular ed curriculum, certainly higher expectations than you might achieve in a specialized classroom. Language-rich environment, same age, typically developing peer models. Research certainly supports improved outcomes for students with disabilities as well as their peers, too, when they're educated together. I can't comment on individual students because it's difficult to know what the results would be in different situations, although I do know that some of my son's same-age peers who do have disabilities certainly don't have a lot of the same experiences and skills as a result of not being part of a regular education classroom. Next slide. So critical skills to learn, communication. I do hear stories of people in high school who don't really have an adequate mode of communication yet, and that can be very problematic. So I listed there some possible areas. It could be low-tech, it could be high-tech, but certainly needs to be considered. Social skills is often considered a lower priority to academics, but I consider that to be one of the most important goals for my son. Next slide. Assistive technology is very often underutilized, and people are becoming aware of touch technology like iPads and so on, so there's increased usage, but teams still struggle with making these happen. Augmentative and alternative communication I've referred to already. In my own case, my son is very verbal but has poor intelligibility and poor organizational skills, and so we're exploring with using iPad with some application for communication with him. And so certainly I encourage you, there's an additional website here from CAST. It is an excellent website that perhaps may be added to the ATLAS. So creating a vision for your child, on the next slide if you would. I encourage you to have your vision for adulthood in the various areas, employment, home, social network, and so on. You may consider a formal facilitated process, identify and develop the skills the child will need in adulthood, and begin to work on those now. Next slide. Since we are from all over the United States, I've included some links here for parent training and information centers. You can find the one in your own state and find more local information. Likewise, for anyone whose child has a developmental disability, each state has a University Center for Excellence, and you can find yours in that link also. Next slide. The extracurricular activities is really an important part that often gets overlooked, and the issue of separate versus integrated extracurriculars. The advantages of the separate are obvious. I won't go through those. However, I will say that the next to last one there, the peers with more similar interests. As your child gets older, it can be more difficult to find peers who have similar interests, and so that might be a consideration for separate. But next slide, I will talk about the advantages of the integrated. Typically developing peers, better role models, certainly higher expectations. In our own case, my son has a particular interest and aptitude for theater. He's been in 4 musicals, numerous plays in both school and private groups. So we've made a lot of effort to make that happen. YMCA is another good resource, your community recreation groups. Next slide. So some of the strategies to make those happen is, first of all, research. What's in your area? Which programs are good? Consider the child's strengths and interests, obviously. The staff ratio and experience are really key factors that I've found. For each situation, I provide written strategy to the staff if I'm not going to be there as to what works and what does not work for him, and provide assistance with needed. Sometimes I participate directly. You might have behavioral health services that can provide support for you. Some areas have the county mental health, intellectual disability organizations may offer some type of sitter respite service. And I've even utilized disability organizations like UCP, United Cerebral Palsy, who have offered occasionally support staff for students to be included in typical activities. So you can research what might be available in your area. So finally, for the concluding thoughts, last slide, I encourage you to continue to maintain high expectations for your child and continue to have active involvement in your child's education. Thank you.
Great, thank you so much, Jennifer. And the next presenter I want to introduce is Malia Corday. She's a project director for the Medical Home project at the Statewide Parent Advocacy Network, SPAN, and a program coordinator for the New Jersey Statewide Parent-to-Parent. Malia?
Good afternoon. My name is Malia Corday, and I'm the proud mother of 3 sons. Today I'm going to talk about my son Kyle, who is 21 years old and has special health care needs. Kyle aged out of the public school system this past June, and today I'm going to talk about the journey our family has had in preparing him for transition to adulthood. Next slide, please. I believe that parents start advocating for their child the day they are born, and in some instances even before they're born, and continue to advocate in some way through the lifespan of their son or daughter. But along the way, parents need to come to terms with the fact that their child will someday become an adult. Parents also need to understand the implications that has for their child and family, and how to resolve some of the challenges that may arise because the youth or young adult may not agree with what you, as the parent, want. As parents, we need to start early to prepare our children for transition and ensure that they have the needed skills, and tools to advocate for themselves as they transition to adult systems. While the federal law states that transition starts at the age of 16, it's 14 years here in New Jersey. It may start much earlier for some youth who need additional supports and learning opportunities to ensure they have the skills necessary to meet their post-secondary goals and to experience a successful transition. Next slide. The idea of transition to adulthood can be overwhelming for many families because there are many things we need to consider to ensure that all of the pieces are in place for transition to be as seamless as possible. What families need to know is that even with very careful planning, things may not always go according to schedule, and flexibility is key. Next slide. So I just wanted to share today some of the things that we've learned along the way with our son Kyle, and just focusing on the school environment. Very early on, we shared Kyle's disability diagnosis, which is spina bifida. He went to a preschool disabled class and then transitioned into a typical kindergarten. And so we wanted to kind of have a discussion early on with his peers and the staff so that everybody would kind of know who Kyle was and what his needs were. And also to have Kyle learn how to communicate about himself and what his needs are. So we used to have an introduction on the first day of school where Kyle would kind of talk about himself and introduce himself, and then we would, ask if any of the kids had any questions. So it was a nice way to kind of integrate him as, part of the classroom right from the start. Also, just letting the students understand, if they do have an IEP or a 504, what that means, and in some way try to get feedback from them about their challenges or what they like about school, and also if they are able to participate in some way in the 504 IEP meetings, to kind of come in and meet the players that will be part of their support system to ensure that the child knows, who to go to if they do have a problem. And also to talk about therapies, why are they, going through these therapies, how can we integrate them into the school day to make sure that it's fun and it's exciting and that it's not, a negative thing, but actually is something that would help them, be better prepared for life. Also middle school, just learning self-advocacy, watching mom and dad and what they do and how they communicate is very helpful to kind of share with your child what they need to learn. Start talking about post-secondary options. What is their vision for, after high school? What are they hoping to do? In high school, you want to start talking more specifically about the child's vision, what goals they have for after high school, if it's college, if it's employment, what is the testing that they may need to make sure that they have everything in place to go to college if that's what they're looking for, that the student understands exactly what accommodations they need to be successful to address some of their challenges. Also to look at community experiences while they're in high school to ensure that they're out in the community being engaged in activities, job sampling, making sure that they have identified the courses that they need to take in order to reach those post-secondary goals. Any other types of evaluations such as a vocational or an assistive technology evaluation. And then graduation. Will the student be staying through graduation through the age of 21, or will they be walking through graduation and not accepting a diploma that possibly, they'd like to stay on to learn some additional skills? Okay, next slide. In the community, we want to, make sure that you're talking about accessibility while they're, young, making sure that if the child has a physical disability or a cognitive disability that, they have full access to whatever activities they're going to be involved in. If there's a communication challenge for that child, how is that communication going to be addressed? It may very well be addressed through technology or some other type of support staff. In middle school, you want to start looking at, there are schools that have their own sports programs, and so transitioning a child from possibly a township type of recreational sport to a more formalized sport could be a challenge. So really working with the coaches and the school to make that a successful transition. Peer mentors. Some middle schools and high schools now have best buddy programs or peer mentor programs to help that student advocate on their own and to engage them into the school activities. Many centers for independent living also have self-advocacy trainings. They often will do them outside of the school, and some schools actually have that training as part of their school curriculum. During high school, you really want to make sure that the community experiences are, based on the needs and the ideas of the student at that point of time, making sure that all of their interests are identified. Job sampling. While job sampling is great to try different things, you really want to make sure that the student does have activities that are centered around those post-secondary goals. Also, volunteer opportunities is to also not just look at employment, but also volunteer opportunities for that student. Social and recreation activities are very important also. Next slide, please. For children who have special health care needs, it's important for them to understand what their diagnosis is and how their special health care needs impacts their lives, both in and out of school. While you probably don't need to share every nuance about their diagnosis or health status, they should be able to communicate effectively if they are having symptoms related to their diagnosis or condition. And so once again, focusing on health is really important. I learned early on that I couldn't just learn to advocate on my son's behalf around education, but the health was just as important, because if his health was not where it should be, then it was definitely going to impact his school environment as well as his home and community. And so it's very important to really look at the whole student and make sure that they're able to advocate on behalf of their own health and being able to understand what their disability is and what they need to do if they are having, a health crisis or observing symptoms that they know could lead to something. So they need to know what steps are to take care of their own health. And in middle school, you really want the youth to start having more input in the medical visits around their own health with their doctors. Many kids have specialists, and so really understanding the different specialists and what their role is in their own health. Being able to feel comfortable with their health care providers, to be able to communicate their concerns and fears. We don't want them holding things in that could, in the future cause problems. Understanding what their medications are and why they take those medications. Understanding that their health history is very important and that they need to share that and have it logged somewhere. So, having a health notebook is very good to keep organized. This way, when they do go to a doctor's visit, they can come home and look through the notebook and see what needs to be updated, what type of information. As they transition to high school, making sure that they are more active in making those appointments and understanding that they've got to remember when those appointments are. Some children do very well around using technology, like Jennifer spoke about earlier. iPads, iPhones have a lot of great apps that have different types of lists and checklists and calendars that can keep them very organized and provide a lot of reminders for them. And so it's just important really to understand that advocacy really needs to be across systems. It needs to be facilitated through the course of a child's life well into young adulthood, and to ensure that the advocacy doesn't start just as they leave high school, but that the adult system can be very scary sometimes, because we've been working with the children's systems of care for so long, and so there may be things that are unexpected. But as Jennifer said earlier, and if we just look at the different resources that are available, such as the ones that are on the slide that I have here and the others that people shared, there's a lot of great resources out there to support you in what you need to look for your child.
Great, thank you so much, Malia. So the next I wanted to introduce Susan Atkins, who's the Washington State Parent-to-Parent Coordinator, which is a program of the ARC of Washington State. Susan?
Oh, hi, everybody. Yes, I'm Susan Atkins, and we have 3 girls, and our oldest daughter was born with Down syndrome. Her name's Alexa. And when I was asked to do this, I wanted to think back about the years she's 30 years old now, and she's been working at her jobs almost 8 years. So I kind of went back and thought about sort of our history and some tips that I've kind of picked up along the way over these 30 years. I've been doing this work for about 26 years. I've been part of Parent-to-Parent for that long. Sharon, do you want to go to the next slide? And there she is, working at Starbucks. That's one of her jobs. She works there. She's been there 8 years, and her other job is at Applebee's, and she's a hostess. Next slide. Well, one of the things I really think is important, and I think everybody's talked about this already, so some of this will be repetitive for all of you, but I think you have to really think about when they're young. It's hard to change behaviors, as you know, as they get older, and so I just encourage parents to really kind of think about it, think about including their child as much as possible in their community, in their church, in their school, in their neighborhood. At our house, we talked a lot about working, and I know for a while we had a play kitchen, and Alexa pretended that she was a hostess or a waitress in a restaurant, and it was even before she could really talk very well, but she used to walk around with a little pad and take orders. So we talked about the importance of working and that everybody would work. Dad and I work, and we'd expect all the girls to work one day. They all had chores around the house as much as they could do, depending on how old they were. They didn't like doing them, but everybody had to help. I was really wanting to make sure that Alexa looked appropriate and looked her age. So I tried to look around to see what kids were wearing when she was at different ages, and sort of dress her or have her dress the same as them and like her sisters. I didn't want her to be too familiar with people that weren't family, so we worked a lot on how to greet people and to be appropriate. And then I used this checklist. Next slide.
Susan, if you could check to make sure your computer speakers are muted, there might be an echo.
Oh, okay. Sorry.
Sorry.
I don't know.
No.
Oh, hi, Micah. This is Sharon. If you could just mute your computer speakers, and then we'll introduce you after, Susan.
Okay, if I mute. Okay. there. Hopefully I'm muted. Well, I like this. Diane Adrian did a Life After High School, 10 Skills to Teach Your Child. But I thought that they were appropriate now, and when people have younger children. I thought one of the big ones turned out to be using an alarm clock to wake up. And as you all know, for all your kids, getting them up in the morning and getting going. But that's turned out to be something that's been really important for Alexa as she's moved out on her own and as she's had a job, is using an alarm clock or something that notifies her it's time by some kind of buzzer. So iPhones worked well for that. Next slide. In middle school, we started to talk about working and where she might want to work, and started to kind of look around in our neighborhood and thinking about it, and her being an appropriate employee, what that would look like, where she might want to work. I started talking to people, friends, neighbors, businesses that we went to, and think about Alexa helping out there when she was in middle school. Next slide. And then as we headed into high school, I think at the time Alexa was going in, it was something that she did at 14. I think now at 16 is there to have a transition IEP meetings. I started having Alexa join us as soon as I could in our IEP meetings. There were many years when she didn't feel very comfortable speaking, or they had trouble understanding her, so I kind of had to speak for her. But I tried to involve her as much as possible and work on some of the goals that they had at school, at home. I didn't pull her out of her academic work, had her included most of the way through school, and I didn't pull her out, have her pulled out much. At least half her day she was in regular classrooms. I thought that was really important, and I wanted to work on a lot of the transition things at home versus at school. We started to talk about where she might want to work, and where she thought it seemed like something she'd like to do. And it was interesting. She didn't want to be outside, and she didn't want any rain on her head, which is Seattle, So that was telling about those things. She doesn't like to do cleaning, so she definitely was not interested in doing anybody's cleaning of anything or any landscaping, because she'd have to be outside. I didn't want her working in fast food necessarily, even those were easier jobs to get, because I just didn't want her to have to think about not eating that food and eating more healthy. She has some deficits where she can't do money, or she can't do time or a calendar, and so those are things we've had to really work on and sort of accommodate those things. She's not a very fast worker. She's pretty slow, but she's very hardworking. She's very friendly. She's appropriate and neat and tidy and clean, and never misses a day. Even I'd have to keep her home if she's sick. So she's a great employee. And we've just had to work on the support. Let's see. So she's worked every summer during high school, and I found her jobs. She worked in our offices. She did filing, making copies, making packets. She worked at a child care center. She found out they were awfully busy, those kids, and decided that wasn't the area she wanted to work in. We used some educational assistance from our school district in the summers to support her, which was really nice. And our county actually helped pay for some of them once she hit age 18. We have to think about transportation. She doesn't drive, so we had to figure out how is she going to get to work and get home and learn to ride the bus. Next slide. So she had worked part-time for her each summer, just like her sisters, and we started to figure out what she wanted to do. She really decided she wanted to be a hostess at a restaurant, and so when she was in the 18 to 21 transition program in our school district, we talked about that, and they helped her find a hostess job at Chili's. And that was one of her jobs, and then the other time she tried out some other things, and she kept coming back to liking to be a hostess. And so Chili's hired her actually to work for them as a hostess before she was 21. Then we started interviewing job support agencies because she's on the waiver, and so she gets, well, in the beginning she got more help, but now she gets 5 hours a month worth of job support. Next slide. I actually helped get her job at Starbucks. I knew someone who worked there, and so I sent them an email. I think that, unfortunately, I think that families and neighbors and friends, the community, church, has to be part of the, trying to help find our kids jobs. It's pretty tough out there. So for all the girls, I really, I've done a lot of networking, looking for jobs for them. So the biggest challenge has been at Starbucks is that the change, turnover, lots of new people all the time, which Alexa at first really disliked, but she's gotten a lot more flexible and better, and they don't seem to be having quite as much turnover. Next slide. And there she is at her jobs. And we're really proud of her. She works very hard, never misses a day, and so she's living with support in an apartment and working. Next slide. I think I'm done. Hopefully I didn't talk too long.
Thank you so much, Susan. So actually, Micah, one of our speakers, is trying to connect right now. So I don't know if Bev and Kathy, you want to take a minute to talk about parent-to-parent and family voices while see if Micah is able to join using his phone.
I actually think he's on, I think he's using the speaker on his computer instead of the phone. But okay, hi, this is Kathy Brill, and I'm the Executive Director of Parent-to-Parent USA. And although most of you probably already know about parent-to-parent support, Parent-to-Parent USA's vision is for all children with disabilities and special health care needs to grow up in a family who supports them to lead full and happy lives in their communities. Of course, in order to make that happen, many times advocacy needs to happen first, as the barriers present often prevent us from attaining our goals and visions, right? So, together, Parent-to-Parent USA, Family Voices, and the Genetic Alliance compiled this ATLAS toolkit so parents, advocates, and self-advocates can find the process of advocating for a cause to hopefully be much less stressful and much more empowering. Parent-to-Parent USA believes immensely in the strength and resiliency of parents, and having effective advocacy tools at their disposal for whatever topic, issue, or challenge presents itself further strengthens those qualities. Bev?
Yes, this is Bev Baker, and I am the co-director of Family Voices Project, the National Center for Family Professional Partnership. So Family Voices, as many of you may have heard of before, was founded in 1992 by families raising children with special health care needs to activate family roles in health care, so really to teach advocacy skills. The mission to achieve family-centered care for all children with special health care needs or disabilities is really all about helping families to advocate.
Hello.
So I'll be done in just a second, Mike, and we can go on to your presentation. So the NCFPP, which, as I mentioned, is a project of Family Voices, is focused on supporting family leaders in every state and D.C. through the funded Family Health Information Centers. And these centers provide info and support to families, and equally important, they advocate for improving policies in their states to improve access to and quality of the services and systems that we depend upon, that the families with special health care needs depend upon. So one of our roles at the National Center is to connect the states in order to facilitate the sharing of resources. Many of the tools contained in the ATLAS toolkit came from these networks of family leaders, both from the Family to Families and the Parent-to-Parent organizations. So we're very pleased with the result, which you're getting to hear about today, and we hope you'll take an opportunity to look through it following the webinar. Thank you.
Great, so I'll just pull Micah's slides up right now, and I'd like to introduce Micah Feldman, who is both a self-advocate and a very strong youth leader, to talk about his experience with youth leadership and some of the skills that he's gained through a particular experience. Micah?
Yeah.
You're all set to
Okay.
go.
Okay. Here's my first slide, and thank you again for having me share my story. I could talk for hours, but that it's a very tight and short webinar. But I just wanted to share what I did in like my summer job this summer. And I'm 29 years old. I am a self-advocate, and I go around and speak at tons of conferences, and I had a chance to do a summer job in Washington through AAPD, and it's a great summer job. And I had a chance to work at the Commission of Community Living and AIDD, and it was a great 30 people got picked to do the summer job, and I was one of the 30 people that got picked. And in my summer internship, I had a chance to go to the White House for the AGA celebration, and I had a chance to meet tons of great people and stuff, and it was cool. And I had a chance to do my PowerPoint for St. College, and I had a chance to meet people at other conferences, and it was a great time. And I had a chance to help help teach people about the CRPD, and I helped. I had a chance to meet Senator Tom Harkin and meet tons of other people. And here's some groups that I have been a part of. I was a part of CASA and NRELN, and I think they are great groups to help people learn about how to be a better self-advocate. And CASA, I think it's around, like I heard that they were trying to find directors, or they're going to show the final update, but I know that CASA was going through lots of changes and stuff, but I think CASA is still on. And like I served on the board for like 9 years, and then I helped with NYLN.
Great. Well, thank you so much. And I think with all those presentations, I think we have a little bit of time for questions. So if anyone has any questions, please type those into the chat box, and we'll read those aloud for the presenters.
Sharon, this is Bev. While we're waiting for the first question, I wanted to, if you want to go back one slide, I wanted to show people that the website to get more information about parent-to-parent and about Family Voices, the National Center, and the CASA program that Micah was just mentioning. Thanks.
And is CASA still around? Because I heard that they're going through tons of changes. So.
Yes, CASA is still around, and the board is still meeting regularly. We are in the process of looking for a new program director, and in the interim, I'm supporting the board. So yes, we are still active.
Okay, all right. Because if you want, feel free to send me an email of the application of the thing, that I can post it on Facebook or send it around to people.
Great, thank you, Micah.
Mm-hmm.
Great, and we did get one question to go back to the slide on resources. So if the person who asked this question, if you could just let me know if this is the right slide you're looking for, or if there's another one, you can send another message to me. There was a question, is there an age limit requirement for CASA to be involved in that?
Yeah. Yeah, I think if it hasn't changed, I think it's 14 to 24, I think.
No, I think that's right, although there was some conversation about extending that to 26. And to be honest with you, I can't remember what decision was made. But yes, that 14 to 24, 26 is accurate.
Great. We had another question. Will this PowerPoint presentation be made available after the webinar? And yes, we will make the PowerPoint available after the webinar. And actually, this would be a great time to point out that this webinar is actually one of a three-part series. We had our first webinar in September. That webinar, Empowering Individuals and Families as Advocates, has been recorded and is available to view on the Genetic Alliance YouTube channel, as well as we do have an upcoming webinar scheduled for November with resources on access, support, and advocacy in the health and insurance world. So we'll dive deeper into some of the other categories of the Advocacy Atlas, featuring some of the resources around communicating with your provider, advocating for your health, insurance, and financial assistance. So I encourage you to join those as well. Okay, we had a question asking, will you do any programs addressing public entitlements? I don't believe we have one scheduled for this project, but I don't know, Kathy and Bev, if you have any upcoming presentations on this topic?
We don't have any upcoming that I'm aware of, but if you're interested, we can certainly put one together if you want to host it, Sharon.
I think we can definitely talk about it, and we'll follow up with about this topic and the person who asked this question.
And if you'll email us, the person who's interested in this topic, perhaps we can make sure that we get resources to you on that topic in the meantime.
Yes, this is Bev, and although we don't have anything planned on that topic, oftentimes the states have webinars or trainings or something available. So, yeah, if we could get more information about what state you're in, we can connect you to the parent-to-parent and the family-to-family, and they may be able to connect you to a training within your state.
Great. We'll connect you, Carol. I see your message, so we'll connect you with that information. The next question, maybe Malia or Jennifer might be able to answer. Are school districts responsible for providing aid for outside social skills groups for a child with ASD and epilepsy? I'm not sure if you know how this works.
I'm sorry, the question, a personal aid, is that what they're?
Our school districts is, responsible for providing aid for outside social skills groups for a child.
And so I'm not sure what they mean by outside, like outside of the school day.
I would assume it's the extracurricular activities, similar to some of the ones that were discussed in the presentation.
Right. So if there are, if there's a student that needs additional supports for extracurricular activities, that can be, as part of the IEP meeting and discussion. And so if that is a need of the student for them to be able to participate, in sports or after-school clubs, that support can be provided through that agency.
Well, if you could just mute your computer speakers, there's a bit of an echo. Thank you.
Oh, it is. Sorry.
Yep. That's fine. That's fine. And that looks like you answered that person's question. So, we got a number of questions about sharing this resource and the archived webinar with families. So we'll make sure you know when it's available, and the slides are available as well. And I guess at this point I'd just like to thank you for your participation today. We don't have much time left for questions, but we do want to encourage you to share the Advocacy Atlas. Maybe link to it on your sites and make sure that it's really reaching the parents and families who are able to use it. So again, thank you so much to the presenters for their participation in this webinar and for sharing their stories. I think that it is the stories, like I mentioned, that really brings this tool to life and will help make it a useful resource for individuals and families. So thank you so much and have a great day.